Hello everyone. In the last lecture, I introduced the theoretical foundations of nursing informatics to you. In this lecture, I want to talk about the applications of information science in nursing informatics. More specifically, we want to talk about what type of information a nursing informatics professional cares to collect and analyze. I think learning a healthcare-related course is really good. First of all, you are learning the knowledge for developing a possible future career. Secondly, you can use the knowledge for yourself. After learning the course, you will understand the healthcare system and how it works in the US. So in the future, you can use this knowledge for your personal healthcare. This is one thought I want to share with everyone before our lecture. Last time I talked about the theoretical foundations of nursing informatics. This picture shows the major aspects of information science. We have a KA, KD, KP, and KT on the top. KA represents knowledge acquisition. KP represents knowledge processing. KT represents knowledge generation. And KD represents knowledge dissemination. This is the theoretical foundation, right? But what nursing informatics professionals cares about to collect and analyze in practice? Let's talk about them. The first type of information is electronic health record, or EHR. If you are a nurse practitioner, you must be familiar to this term. If you are a data analytics student, this term could be new to you. Let me explain this term to you. If a patient wants to visit a doctor, when the patient arrives in the hospital or the clinic, the first person the patient will see is not the doctor, but a nurse. The nurse will collect data from the patients, such as the patient's weight, height, blood pressure, blood type, allergy history, medication history, and so on. Then the nurse will record this information into a computer system. That will be the EHR computer system. The nurse will create a profile for this patient and generate a unique ID for this patient. In the future, the nurse can track down the patient's data, and the doctor can also track down the patient data by using this unique patient ID. The patient can track down this information on his or her own as well. If the patient wants to visit a doctor in another hospital, the patient can offer this unique ID so that the other doctor or nurse can also look at the information in this patient profile. This digitalized record is called an EHR. Some classmates may say, this is what I get when I visit a hospital. What's a big deal about it? That's because EHR has been implemented for several years. So we get used to the digitalized medical record system already. But before a EHR system was implemented, all the medical records were handwritten on notes. Do you still remember that medical school joke? If you write something that is not readable, your friend will say, "Hey, you are not in a medical school." Of course, this is a joke, but it means some handwritten medical records are not clear enough to read. If the record is illegible, how can we keep it accurate and reliable? With a EHR system, we don't have this problem. Another benefit we can get is the data records can be shared in a EHR system if the patient gives permission. Like the example I just gave to you. If the patient decides to go to another hospital, he or she gives the permissions, another hospital can pull data from the EHR system. So the hospital, the doctor, or the nurse can avoid some tests that has been done in our hospital. By doing this, we can save some cost for this patient. A EHR system sounds like an important system, but what role can a nursing informatics professional play in a EHR system? Several important rules. First, a nursing informatics professional should be able to install and manage a EHR system in a healthcare organization. Second, the informatics professional should keep the medical records secure in a EHR system. Third, an informatics professional should be able to analyze the medical records in a group and generate some analytical reports for the healthcare organization administrators. For example, the head of a hospital wants to know what is the average income level of the patients this hospital serves. The nursing informatics professional should be able to get this data from the EHR system and then analyze the answer. An informatics professional is a liaison between a healthcare organization and a EHR software company. Usually, a hospital doesn't develop a EHR system in-house. They will usually buy a EHR system directly from a software company. As an informatics professional, we understand the technical terms. So if our members meet some technical issues, we will provide the support. If we cannot answer their questions, we should be able to explain this question to the EHR software company, so the developers in that company will understand what the problem is. When you get the solution, you should be able to explain the solution to the organization members in a plain language. These are the rules that a nursing informatics professional play in a EHR management process. If I want to apply for a EHR management position, what types of knowledge should I prepare? Actually, people from both medical field and the data analytics field can take a EHR management position. If you are from the medical field, you have a medical education background, knowing how to manage a computer system is definitely an important requirement for a EHR management position. If you are from a data analytics field, knowing how to manage a computer system shouldn't be a problem to you. But you have to learn some medical terms, understand them. And also you want to know what is the regulation, the law for managing and analyzing medical records. This is important for people from data analytics field. Another important aspect of nursing informatics is healthcare resource management, or HRM. Another term of HRM is administrative information system. This profession cares about how to record and manage the information of resources that a healthcare organization has. Those resources could include human resources like nurses and doctors, or facility resources, and so on. The HRM system managers care about this information because they want to optimize the use of those healthcare resources and provide support information to a healthcare organization administrator's decision making. If a EHR system focuses on the patients, the HRM system focuses on the internal management of a healthcare organization. For example, the HRM analysts want to know how many nurses a hospital has, how to design the work shifts for those nurses, so that the hospital can use the least amount of cost to provide care to patients at the busiest time. This is an example of HRM informatics. Students from data analytics field should be familiar to this internal management process, right? An equivalent term in management study is Enterprise Resource Planning, or ERP. HRM is a very good application of ERP in the healthcare field. Next, I want to talk about predictive analytics. I don't think the textbook talks about this concept, but I think it's important, so let's talk about it. The goal of predictive analytics is to forecast the future outcomes based on the analysis of historical data. For example, we need to provide emergency care to a patient after he or she suffers a heart attack. But with predictive analytics, we want to know what signs could show a person is likely to suffer a heart attack and provide preventive care to this person before the heart attack happens. As you can see in this example, the nursing informatics professionals are not simply recording data in a healthcare providing process. They are playing a more engaging and active role with predictive analytics. That's why predictive analytics is becoming very important to nursing informatics, clinical analytics, and pharmaceutical research.